Hi, my name is Vikram Gupta. I'm back after a long break. Today we're going to talk about travel medicine. People are now traveling again, and a lot of my patients are going back to visit their families in South America, Africa, India, and they've been asking me a lot of questions about how to protect themselves from malaria, typhoid, or cholera, or any other conditions that are more endemic to those areas. So today would be a good day to review some of these basic guidelines, and obviously I can answer more questions in detail as they may arise. So before traveling, the more common vaccines that everybody should have right now is the COVID vaccine, and we're soon entering the flu season, so the flu vaccine is also going to be highly recommended if you're traveling after the month of September. Other vaccines like MMR, varicella against the measles, mumps, they are also recommended that you're up to date. And if you're traveling to any of the countries like South America, India, or Africa, hepatitis A vaccine or having immunity to hepatitis A, these are highly recommended. Medicines-wise, malaria is the most common condition that we encounter, and the medication requirements for India versus South America versus Africa can vary. So you gotta ask your doctor if you should be on mefloquine or chloroquine or doxycycline. There are about like 5 different medications that can be taken as prevention against malaria, but that varies on the region, and your doctor can definitely help you with the appropriate prophylaxis or prevention against malaria. Obviously, avoiding bug bites and using bug sprays is quite helpful as well. You don't always need medication to protect you against malaria. If you're going to an area where this is not the mosquito season, you're going to a colder area where you don't have mosquitoes, then you don't need prophylaxis for malaria. A routine vaccination is what we all get as children, and then certain vaccines we keep getting even as adults, and they're like the measles, mumps, rubella, hepatitis vaccine, hepatitis A vaccine, meningitis vaccine. These are routine vaccinations that everybody usually gets. Now COVID has also become a routine vaccination, and everybody is highly recommended to get that. Now, a required vaccination is that you cannot enter that country or that place without having proof of that vaccination. That doesn't mean that you cannot go to another country or it's necessary, but it is necessary for that particular place of travel or to that event. So a recommended vaccine it's again not necessary, but it's highly recommended that you get, because the chances of getting infected is quite high. So one would be taking on a relatively high risk of contracting that disease if they're not vaccinated. But again, it's not mandatory. So how long do travel vaccines last? This is dependent on the vaccine, not necessarily where you're traveling to. So that depends on the kind of vaccine and how long the booster lasts. For example, for tetanus, one is expected to be immune for about 10 years. And for COVID, we're going at about 6 months. If you have any more questions about travel medicine or malaria, please reach out to your medical provider. If you like this video, please like it, share it, and subscribe to my channel. Thank you.